Actually going to take just a minute or two to summarize. So if you all would like to
Depart?
take your seats, you can take your seats,
Right,
and
adjourn us.
we'll wrap up relatively quickly here, since we're just a little bit over time right now. I'm not going to try to take on the task of summarizing everything that we heard in the last couple of days, but I do want to try to at least hit a few of the perspective and high points. We are clearly at a point now where we would like to think about this issue of variability and susceptibility from the standpoint of what kind of additional targeted research can we do to advance this issue. I heard a number of people during the course of the day yesterday say, you know, we've been struggling with this issue for 10 years, and we just don't seem to be able to make the kind of progress that we need. I talked about at the beginning sort of my vision for outcomes for this, and it really would be targeted research, improved risk assessment, and informed decision-making. And I think through the course of the last day and a half, we've heard about the importance of each of those with regard to this particular topic. The science and judgment, science and decisions from the NRC reminded us that variability is inherent in populations, and that it can't be reduced, but it can be better characterized. And I think one of the take-home messages here is that all of us are resonating with the idea that we need to do a better job characterizing the variability, because susceptibility needs to be discussed in that context of the variability. And the things that we heard over the course of the last couple of days suggest to us that that discussion needs to take up the question of quantitative differences with regard to susceptibility, but also qualitative differences with regard to susceptibility. And so it's not simply a matter of saying, is a tenfold factor great enough? It really is an issue of, are there differences that we have not yet recognized because of our lack of understanding of both variability and susceptibility that would cause us to take different approaches to informing decision-making or communicating with the public? So I think that's a particularly important issue for us as we wrap this up. You know, we had 3 talks yesterday morning that were designed around orienting us to the issues that I just described. And those 3 talks, in my mind, sort of set the bounds around this relatively large field that we were trying to get our arms around. Nat Rothman really, through his experience with epidemiology studies, talked about the striking amount of variability that one sees in human populations, and we can't get away from that. But he also gave us some very good hope around the fact that if we have the ability to understand the molecular biology, understand some of the physiology in human populations, and understand behavior of individuals, that we begin to focus in on who that susceptible group is, and can do a much better job at thinking about both informing that group and perhaps providing some solutions, regulatory or otherwise, to deal with that. Claudia talked to us about tools for interrogating self-reported chemical intolerance and the importance of really listening to human populations in terms of whether or not they are dealing with issues that might be ascribed to susceptibility and response. We also talked about the fact that in some cases, this reinforces the idea that some of the observations that we make are not etiologic diagnoses, but in fact they are representative of perhaps earlier events that then respond more sensitively to various types of exposures, and that's going to be important for us. Eric Schott talked about new approaches to sequencing that I think we would all say are amazing and are sort of really pushing the envelope. But my take home from that was that what that's really giving us is not just another way to look at SNPs or ETLs or other QTLs or other types of situations, but really giving us the opportunity to look at remote relationships between genes that we haven't had before. And his discussion around the idea of the basis for virulence and increased susceptibility, and in fact, common therapeutics actually making the situation worse because of these relationships with genes was really pretty remarkable. And that makes this even a larger issue for us to deal with. We heard about a range of tools, and I'm not going to go in any sense through that, but I was very impressed with the discussion around the value of at least considering the diverse outbred strains. And we've heard about that now as sort of a new tool that takes us in a different direction that as classical toxicologists we had gone in the past, where we had focused in on inbred strains for their consistency of response. I think that Joel Schwartz gave us an appreciation for the fact that the impact of individual thresholds on population distributions of response is something that we really need to look at. And again, this issue of qualitative versus quantitative responses is something that comes up there. I really think the discussions that we had around the public health implications that basically suggested that our current approaches to case control studies needs improvement, and there's lots of additional information that could be brought in there. And when we really look at the opportunity to take some lessons from the pharma industry and stratified medicines, as Richard said, I think we do have the opportunity to begin to think more and more about how toxicology and research can impact on both population and individual decision making. The development of drugs that are tied to a mode of action or targets are considered to be optimal, but even in the pharma industry, we're still reacting to what we see in phase 3 clinical trials. So there's still room for improvement there, but there's some real hope given by the kinds of successes that we've had. I appreciated Mike Darson's and Wei-Shui Chu's discussions around the risk assessment implications. I think there's a real call there for us to use more chemical-specific adjustment factors and to really think about how that can affect our decision around using a tenfold uncertainty factor within human population variability. That's something that, as I said, we've struggled with for a long time, and we're starting to see some advances there, but we need to go further with a better research base. I thought the 3 panels this morning were excellent. The Community Perspectives panel reminded us of the breadth of our stakeholders for these kinds of issues, and I think that the discussion around the opportunity of trusted advisors to decision making in that process is something that we all need to take to heart. The fact that we're encouraged to really focus on understanding some of these issues at a more granular level than we have in the past, and to really think about how we can get into this. And finally, the observation that Barbara Bissiker made about variable expressivity, and that the confounding nature of that in terms of both diagnosis, predictivity, and communication, I think, is something that is a lesson that we can take from her experience into the kind of work we're doing in risk assessment. Nick Ashford talked about alternative approaches to risk and decision making, and perhaps looking at ways to use new technologies rather than controlling older technologies. I think there's an opportunity for us there as long as we're not trading knowns for unknowns, and I think that's an important part of that. I think this issue of how we actually bring that kind of decision-making into account is going to be important. Finally, I think the discussions that we had around informing risk assessment and regulatory decision-making, there clearly was an interest there in looking at how we could bring disparate sets of data together, how we could apply informatics approaches to informing this. And they talked specifically about this issue of whether the problem that we're facing is differences along a continuum or whether or not it's really qualitative differences in the way that we view susceptibility. And I think that is something that we need to go back and spend some more quality time on. Another important point that came out of that, and I think came up again in our research panel, was that we need to look for approaches that encourage addressing uncertainties that have been identified in some of our risk assessments or in some of our epidemiology studies. And so those uncertainties get raised and talked about, but then they're never addressed with research, or they're not the focus of a request for proposals or other sorts of things. And by the time we come back around again on the risk assessment, that issue is still hanging out there. Finally, the research panel, I thought they did a nice job, and Richard set the stage well by talking about the importance of integration of various types of information. It's very clear that this particular issue, as broad as it is going to take interdisciplinary problem solving, and that a systems approach to trying to look at this is going to be important for us if we can define the system. I think that's the critical if. I've already talked about some of the examples through the course of the workshop that were highlighted here on the use of outbreak strains, the importance of partnerships between NIH and regulatory agencies in order to really think about the right kind of research to answer the important questions, and the variety of targets for education and communication that we might have out there, and the lessons that we can take from social sciences and other disciplines to essentially really advance the kind of things we're doing within our work here. So these were, I think, all important issues coming out of the research panel. Just as a plug, our June workshop of this group is going to be looking at systems approaches in molecular biology for improving the way we do risk assessment, and so I think we'll be exploring more of those kinds of issues in that June workshop, and would encourage you to think about attending if you can. With that, I'd like to just thank all of the speakers, all of the panelists, all of the participants who actually got engaged in this meeting. That's what this is all about, having the kind of dialogue that we've had over the last day and a half. I also have to thank Marilee and Keegan and Aisha, our staff here at the NRC, who do such a great job in helping us work to put these kind of workshops together. And just an announcement for our panel, our committee members and our liaison group, we're going to need to move pretty quickly up to room 204 to start our next meeting. So with that, thank you all for attending. Thanks for another very good workshop, and stay tuned to the website. We may very well have some things in addition to the materials from this workshop out as we think about putting together a newsletter. Thanks.